Today we are talking about the Micronus. Micronus or myoclonus. Myoclonus or myoclonus. The myoclonus is brief, rapid, jerky movements, but they are very rapid and they last less than 100 milliseconds. The myoclonus is brief, rapid, that is less than 100 millisecond jerky movements. Myoclonus is brief, rapid, jerky movements. The myoclonus can be focal, segmental, multifocal. They can be focal, segmental, multifocal, generalized, they may be associated with voluntary movements. Maybe voluntary movements. When they associated with voluntary movements, this is called action myoclonus. There is also a negative myoclonus and a reflex myoclonus. There is also a negative myoclonus. The negative myoclonus, that is loss of muscle tone. When there is loss of muscle tone, this is called negative myoclonus. Example of the negative myoclonus is hysteresis and hepatic failure. Hysteresis and hepatic failure. There may be a reflex myoclonus. Myoclonus may be a reflex myoclonus. The reflex myoclonus is due to external stimuli. The myoclonus sometimes may be severe, but normally mild myoclonus, there will be no clinical importance. For example, when we waking up from sleep or going to sleep, there is myoclonus. When we waking up from sleep or going to sleep, there is myoclonus, but this is no clinical significance. This is no clinical significance. When we waking up or when we going to sleep, there will be myoclonus. Other name, there is a myoclonic jerks. What is myoclonic? Myoclonic jerks. Myoclonic jerk is associated with other systemic diseases. For example, abnormal cortical and subcortical or brainstem or spinal cord lesions due to hypoxemia. Cortical or subcortical or spinal cord lesions due to hypoxemia. Due to hypoxemia, the cortical, subcortical, spinal cord or other brainstem lesions, there may be the myoclonic jerks. The myoclonic jerks are also present in cardiac arrest. arrests. The myoclonic jerks may be due to metabolic disturbances. Due to metabolic disturbances. Due to metabolic disturbances, there may be the myoclonic jerks. But due to metabolic disturbances, the myoclonic jerk is called reverse myoclonus. Reverse. This is reversible. Example of the metabolic disturbances that causes the myoclonic jerks. Example is renal failure, electrolyte imbalance, hypocalcemia, are due to toxin. There may be metabolic disturbances that cause the reversible myoclonic jerks. The action myoclonus is due to the movement. Other myoclonic jerks is called EPM1. EPM1. Epilepsy associated with myoclonic jerks. EPM1. There is myoclonic epilepsy. In this, there is myoclonic epilepsy. Epilepsy. This is autosomal recessive disorder. EPM1 is autosomal recessive disorder. In this EPM1, there is mutation in the gene called CSBT gene. There is mutation in the CSBT gene. When there is no epilepsy, usually there is epilepsy. When there is no epilepsy, the mitochondrial diseases and neurodegenerative diseases should be considered. When no epilepsy, there is normally epilepsy. When there is no epilepsy, then there is mitochondrial disease. Mitochondrial disease or other neurodegenerative disease should be considered. Other type of myoclonic jerks is called myoclonus with Lafora body epilepsy. Myoclonics with Lafora body epilepsy. Myoclonus with Lafora body epilepsy. With Lafora body epilepsy. There is myoclonus and Lafora body epilepsy. What is myoclonus with Lafora body epilepsy? In this type of epilepsy, there is mutation in the EPM2A gene. There is mutation in the EPM2A gene, and there is also steroid lipofuscinosis. Myoclonus associated with Lafora body epilepsy. The mutation in the EPM2A gene, and there is also the steroid lipofuscinosis. Other type of myoclonus is called essential myoclonus. Essential myoclonus. Essential myoclonus. Essential myoclonus. What is essential myoclonus? The essential myoclonus is benign familial condition. This is benign. The essential myoclonus is benign familial, due to family history. Benign familial condition, and this is multifocal, and very brief lightning like movements. Very brief movements, very brief movements in the essential myoclonus. Very brief movements like lightning. And they are alcohol sensitive. When we take alcohol or when the patient takes alcohol, this is very sensitive to alcohol use. And this is essential myoclonus, that is benign, familial, multifocal condition, very brief movements like lightning, and they are alcohol sensitive. Other is the myoclonic dystonia. Myoclonic dystonia. In the myoclonic dystonia, there is myoclonus and dystonia. The myoclonic dystonia is due to the epsilon sarcoglycan gene mutation. Is due to the epsilon sarcoglycan gene mutation. Is due to epsilon sarcoglycan gene mutation caused the myoclonic dystonia. What is the treatment of myoclonus? Now we will discuss the treatment of myoclonus. The treatment of myoclonus. In the treatment of myoclonus, we manage the underlying cause. What is the cause of the myoclonus? We manage the cause. We remove the offending agent. That cause myoclonus. For example, in the essential myoclonus, this is alcohol sensitive. We remove the alcohol. We stop the alcohol. We advise the patient to stop alcohol. The other treatment if the myoclonus is severe, the other treatment is valproic acid. 800 to 3 gram per day. Paracetam 8 to 20 gram per day, and clonazepam 2 to 15 mg per day. Clonazepam 2 to 15 mg per day. Levetiracetam 1 gram to 3 gram per day, and primamidine 500 mg to 1 gram per day. We can also give the 5-hydroxytryptophan and carbidopa. This is the 8 to 200 mg, not gram. Paracetam 8 to 200 mg per day, and 5-hydroxytryptophan and carbidopa we can also give. 5-hydroxytryptophan 5-hydroxytryptophan with carbidopa. We can also give 5-hydroxytryptophan with carbidopa to stop the myoclonus. We can also give the valproic acid 800 to 3 gram per day, paracetam 8 to 200 mg per day, clonazepam 2 to 15 mg per day, levetiracetam 1 gram to 3 gram per day, primamidine 500 mg to 1 gram per day. This is the management of myoclonus. When the myoclonus is severe and will disturb the life of a patient, we can give these drugs.